Nally, I'm coming to you on one of the YouTube lives. I've not done this before. I was going to try to check it out. I'm sitting here waiting for some smoked meat to finish for Mother's Day, and my wife's down taking care of some stuff in the other room, and I just lost my video. That's kind of weird. It's really strange. I'm not totally sure what's happening. I'm going to try to flip the screen, the camera. There we go. Let's see if that works. Kind of strange. Anyway, will we be communicating? Yes, JC, I will try to communicate if I can as questions pop up. But I just thought what I would ask is, well, what I talk about is if you have questions. I've had a number of people as I've been signing on or I've been doing some Facebook Lives that they've asked, what's it like to live for 15 years in a low-carb ketogenic lifestyle? And I'm using a selfie stick here. I'm trying to see if this is going to work. Kind of strange. Anyway, I'm sitting out here on my back porch. You can hear the birds. You can probably see the animals as they come up. We may have a goat join us or two here. Anyway, and so I thought I would just talk about what are the pros and cons of living a ketogenic lifestyle over the last 15 years. I started doing what we referred to early on as low carb, and then about 5 years into that, we realized what ketosis was and how low carbs drove a ketogenic lifestyle. So I've been keeping my carbohydrate levels less than about 20 or 30 grams. 30 grams initially, but less than 20 for about 15 years. And so that's really where we're at. And that's where I've been. One of the things that I found was I had a great deal of trouble losing weight with just a low-fat dietary approach. And I was exercising and running triathlons with my wife and things of that nature and still gaining weight with that. Anyway, there's my sweet wife. She says, no, I'm not going on camera. Anyway, so that was one of the questions that I had posed to me frequently was, how do you do it and what do you do? Well, it really was not that hard. I did it because of a health issue and found that it was the only way that I could actually lose and maintain weight. I lost about 65 pounds in the first 6 months just by eating bacon and sausage for breakfast, a lettuce-wrapped hamburger at lunch, and a piece of meat and a salad at dinner. And that's really what it was, that simple. I found that I saw such success with that as we did it with patients and started having patients do it, they were seeing great success. And not only that, we were seeing their diabetes reverse, we were seeing their blood pressure improve, we were seeing improvement in their cholesterol profiles. I had patients with gout and kidney stones that all of a sudden stopped having gout and kidney stones. Their uric acid levels would turn to normal. I started stopping people's blood pressure medicines because they became too strong for them. I started stopping patients' cholesterol medications because their cholesterol began to normalize. Then we started looking real closely at what cholesterol does and looking at the markers that we've used before with cholesterol and finding that those weren't, and they aren't, LDL-C and total cholesterol really mean nothing in regards to your risk for heart disease and stroke. And so that's one of the things that we started looking at there. And over time started collecting data into what we were seeing. My big concern is if I myself or if my patients were following a low-carb lifestyle or a ketogenic lifestyle, what was this doing to their cholesterol levels? What was this doing to their overall body weight? What was this doing to their risk for heart disease and stroke? So we started doing carotid intimal studies. These are extra ultrasounds of your arteries in your neck, looking to see is plaque getting better, is it getting worse? And we can use that with both the measurement of the wall thickness, called a CIMT, or an intimal thickness measurement, and the actual looking at if there's any blockage there to see if that changes their risk. And I was finding and have been finding over the last, I think we've been doing those for about 10 years, 9 to 10 years, that the blockage would reverse by about 10% per year, sometimes more, sometimes less, depending on how tightly a person watched their diet. But that's essentially what was happening and what we started seeing. And so some pretty exciting things to see with cholesterol, with blood pressure, blood sugar, all the diseases of civilization started reversing. That's why I wrote the book, The Keto Cure. That's why I started doing what I did with that book, is because of what we started seeing there. And wanted to just share that. And so I've been in practice about 20 years. For those of you that don't know who I am, I'm a family physician, board-certified family medicine, board-certified obesity medicine, and enjoy doing that. One of my goats is here with me. I'm going to see if you can see her. This is one of our goats here. She's up here joining me. She's going to pull this up so you can see it. There we go. She's going to probably lick me or end up having fun. Anyway, so here on the farm, for those of you that are interested, but anyway, that's what we started seeing is tremendous success in 16 different disease processes that are with patients. Yeah, PJ, I have 4 miniature goats, and they're actually a lot of fun. They usually will join us here shortly. And she may start nibbling on my shirt in just a minute. We'll see. but I'm sitting here waiting for. I have a big chuck roast that we're gonna shred into some low carb Mother's Day keto tacos, and so we've got family coming over in a few minutes, and so, or about probably 30 minutes. So I thought I would sit here as I'm waiting for it to finish up and waiting for my smoker to finish smoking to talk a little bit about that. If you guys have questions about living a low carb lifestyle, what it's like, pop them up in there. I know that this is a new medium that I've been using, so there's probably not a lot of people on here watching right now. I often use Facebook Live, but I thought I would see how this rolls over to YouTube and see what happens with the data. I like YouTube, and I also like Facebook, and we'll see how it turns out. Anyway, so what other benefits happen? Well, number one, my sleep improved tremendously. I started seeing that I could sleep. I slept better. I needed less sleep. I had tremendously more energy and didn't get that after lunch lull because I was in ketosis, and I'm insulin resistant. And if you haven't seen my videos about insulin resistance and what that means, check those out below. Subscribe down there and check that out. Hopefully that'll be able to give you some insight into what that means. But because I was producing extra insulin in response to starches or sugars, I would get sleepy after a starchy meal, especially after lunch, and that disappeared. I had tremendous energy. I started feeling like exercising, where before I had to just drive myself to exercise, I started feeling like I wanted to exercise. For the first few years, though, I stopped exercising just to see, can I maintain this lifestyle without doing a lot of exercise? And the goats are starting to join me here. Let me see if I can show you here. Can you see? This is one of my goats right there. We'll see what she does. There's a couple of them. I'm sitting here, and they're gonna watch us. Anyway, so for a period of time, I just stopped exercising, other than some of the yard work we did around the yard with animals and with the horses that I have. I've maintained weight, actually lost weight, maintained cholesterol levels and all those kind of things without doing a tremendous amount of exercise. In the last few years, I've started exercising again, lifting weights again heavily, because I enjoy doing it. Found that was a great stress reduction for me. What other benefits do you find with a ketogenic lifestyle? I see tremendous decrease risk in progression to diabetes, number one, and I'm pre-diabetic or have been, and I reversed that risk dramatically. My previous insulin levels were higher. My A1C dropped from almost in the diabetic range to less. 5.1 was actually 5.0 percent was my last hemoglobin A1C, which is a 90-day blood sugar average that your doctor may check with you. Triglyceride levels that used to be almost in the 400 range have dropped down into the 51 is the last triglyceride that I had measured. Triglyceride is a passenger inside the cholesterol molecule, and it gives you anything over 100 gives you a good indicator as to whether your risk for formation of the bad cholesterol. These are the small, dense particles that are not oxidized that actually can increase your risk for heart disease. So those are things that improve. And it improves it dramatically with this type of lifestyle. I actually find that I am not as hungry. So even though I'm eating meats and cheeses and things like that, which a lot of people say, well, Dr. Nally, that's more expensive. From the perspective of how often or frequently I eat, I actually eat less because I'm just not as hungry. Now, initially, I ate a lot more because I had such carb cravings and I was so insulin resistant that I actually ate, in the first 6 months, I think I ate about a pound of sausage and 3 eggs cooked in butter every morning for breakfast, just because I was ravenous. But I found that all of a sudden I was eating because I felt like I had to eat, not because I was actually hungry. So that's one of the things that you may find as well, is you actually eat less. It takes people anywhere from 6 weeks to sometimes 3 months to really get in and feel what their bodies are doing. Ron says, I was running type 2 diabetes and my A1C was 5.4. Oh, fantastic. Your last A1C dropped 5.4. That's fantastic, Ron. Congratulations. Love that. And I see that with people all the time. Their A1Cs were 7, 8, 9. I had one patient whose A1C was 12.4. That person's A1C is now down to 5.2. I think it was 5.2 was the last one. And they've come off most of their medications, doing very, very well in that regard. So actually really impressive and exciting to see those kind of things happen and change hands. And my goat is down here below me trying to nibble the string on this selfie stick that I've got holding here. Anyway, maybe you can see me better that way and enjoy looking at the wall on my house. But so we see a tremendous amount of improvement in patients' overall risk for heart disease, for diabetes, for blood pressure. PJ says, my first visit from northern rural Michigan, my husband and I are both doing keto. Very successful so far, down 34 pounds. Congratulations, that's awesome. That's fantastic. I really am excited by this. And one of the things I've found is, I started using this as a method to teach or to train, to help people reduce disease. And I found that I spend so much time counseling that I decided that putting up these videos is one of the best ways I can just send people and say, hey, I want you to watch the videos. This will give you a lot more insight into how to improve your health as we address the other health concerns that they're going through. So I've started rolling these over to YouTube so that they're available for everyone to watch and see. There's a bunch of great people out there that do low carb and ketogenic lifestyles, and so don't be afraid to watch them. I'm going to try to put up more of these videos on YouTube more frequently. I think I like the medium, and we'll see how it works. And I'm using it more as a reference for both my patients and those patients that are interested in doing this type of lifestyle. So if you have any questions, please pop them up on the screen. Again, my name is Dr. Adam Nally. I'm a board-certified family physician and a board-certified obesity medicine specialist. And I've been in practice about 20 years in the Surprise, Phoenix, Northwest Phoenix area. I'm in a city called Surprise, which is in the northwest part of the valley. And it's Sunday, it's Mother's Day. We've been having a wonderful day. We got up early. I've been smoking a brisket for, actually it's a large chuck roast for family that's coming over for, I think we're on hour 18 now. So we're gonna do some pulled beef with tacos, which actually sound really yummy. And we'll go from there, but you guys have a great, PJ said I bought the book this week. Oh, thank you. And PJ, let me know what you think. Hope you enjoy it. Hope it gives you some good insight. Some basics for those of you who may be new, just joining on, never seen it before. Number one, keep the carbohydrate levels less than 20 grams per day. PJ, it's in the book. It'll tell you how to do that. Number two, there's some protein calculators. Ron says, I began 340 pounds, weighed this afternoon at 248. Wow, Ron, you're down almost 100 pounds. That's awesome. Congratulations. I love that. That is fantastic. Really, that's really cool. Down 100 pounds. Has that been a year, Ron, or how long has that been? So then there are some protein calculations either on my website at docmuscles.com or in the book. PJ, you can find those there. You'll calculate up your protein need based on the height and the amount of activity that you do on a regular basis. And then we use, and I tell people to start with a 1-to-1 ratio of protein to fat, where for every gram of protein, you're having a gram of fat. That 1-to-1 ratio gives people a good ballpark starting point. I don't like to use macros because that people feel obligated to eat too much fat when they're not really that hungry, and your body's hormones will tell you how much you need. Our fat cells produce huge amounts of hormone, and those hormones dictate it. And Ron, since last year, he's been keto since last year. Oh, that's fantastic, Ron. 100 pounds in just over a year. That's fabulous. So your body, your fat cells, and excuse my dog's barking at the neighbor going by, your fat cells produce a number of hormones. Those hormones dictate your hunger. And depending on what your fat cells feel like they need to be doing and the amount of insulin that's being stimulated by your body, that will drive that hunger. So I find that if you start with a 1-to-1 ratio of protein to fat, and you know how much as a basic protein you need, then you use fat as a lever, and you increase the fat if you're hungry, you decrease the fat if you're not so hungry, and you'll find that works very, very well. I'm not a fan of counting calories because that again confuses people too much, and I'm not a fan of macros because those confuse people as well. So keep the carbs under 20, find your protein need, and then do a 1-to-1 ratio. And I've been doing that for years. That's just been my norm. I try to maintain my protein about where I think I need it. For me, it's about somewhere between 95 to 120 grams, depending on how physically active I am. And my body will actually tell me that. I'll actually find that if I'm eating enough protein, I feel more fatigued, as well as one cause. But that's something to look at. So hopefully that gives you some insight into what is this like for a while? What are you doing it for? I find that I actually eat less. I don't eat nearly as often. Our food bill is not nearly what it was before, even though I'm eating real food, real meats and cheeses, things of that nature. If we can, we like to grow some of our own leafy greens. I have a little koi pond and an aquaponics system that we do. What's my take on caffeine? I like caffeine, Ron. Caffeine is one of the it's one of the adrenergic stimulus to the fat cell. I find that if caffeine's used correctly, it actually enhances your ability to lose weight. I find that if you do excessive caffeine, though, it can cause a stress response and it can actually inhibit weight loss. So depending on what your goals are, I have no problem with the use of caffeine. I find that it works nicely in increasing the metabolism slightly, stimulating alertness. Just remember that if you go over about 100 grams of caffeine in a 4-hour window, you'll end up having you can actually get caffeine toxic, which is where you start seeing problems with that. So I try to keep my caffeine intake somewhere around or less than 100 grams per 4-hour window. That's kind of what the average I find seems to work really well. Some people use a little more, some people don't use any. I have no problem either way. I find both people do really well. Good question. But I think that I've talked about it in previous videos. There are 5 essentially back doors to the fat cell. Caffeine actually helps enhance fat exiting from one of those doors as long as your insulin levels are already down. That's one of the adrenergic effects. It has a stimulatory effect on the catecholamines, but when it gets too high, it actually can have an opposite effect. So something to be aware of. The catecholamines, which are adrenaline, dopamine, norepinephrine, those catecholamines, as they build, they are effective, and as they get too high, they actually have an opposite effect. So there's kind of this opposite effect of those. And we'll talk about that in I think we've talked about it a little bit in one of the other videos, and I may bring that one up again later. So. Well, guys, you have a great Sunday. I hope you give your mom a hug, give your wife a hug from Dr. Nally. I hope you guys have a wonderful Mother's Day. I think my meat's about ready to get finished up here on the smoker. Denise, it's a pleasure to see you. Please watch the videos. If you like what you're seeing, subscribe, please. Click the thumbs up button so people know that you're enjoying what you're seeing there. Check out my website, darkmuscles.com. And check out the information that I have there too. I've got a lot of my Facebook Live videos are there on that darkmuscles.com under Dark Muscles Live. So check out that. Check out the blog. Hopefully you get some great information that helps dispel a lot of the myths from a lot of the so-called keto experts that are out there. PJ, thank you. Enjoy the book. Hope you have a good time. You guys remember, keep the carbs low, keep the fat high, and we'll talk to you soon. Pass the bacon. Take care, guys. Bye-bye.